Show right now. John Fitzgerald, welcome to the John Fredericks Show.
Good morning, John. Thank you for that kind introduction.
Well, you know what? You've earned it, and you've got a lot of knowledge in this thing. And I really want, I've been getting some of the hospital CEOs in Virginia on my show because, in my mind, we got a real hospital crisis. And although Medicaid expansion ties into it, we have to solve it. Now, I've got a couple things I want to start with, John. I know that you're past chairman of the Virginia Hospital and Healthcare Association, which this week launched a new public awareness campaign focused on communicating with everyday Virginians and elected officials about the challenges I just said facing hospitals and the health systems. And by the way, the ads are also running on our network. Yay! Good call. I've got the most listeners in Virginia. I'm the gorilla of talk radio. So thank you, Association, for running ads on my show to reach all these people. Now, John, what can you tell our audience about this effort?
Well, John, the name of the campaign is Virginia Hospitals Our Lifeline. And its message is simple. Hospitals and health systems are really vitally important to the community. We provide somewhere in the area of like 115,000 direct jobs. The statistics that I read are around $36 billion positive economic activity for our state and protect the public well-being. We're always open to help, to provide care to people in their time of need. And that's the good news. But here's the distressing news. Virginia hospitals and health systems face serious challenges that threaten all of those valuable benefits. Continuing government cuts to reimbursement, sequestration, and big reductions from the Affordable Care Act are inflicting financial pain. At the same time, hospitals have mandates to treat people who can't afford care, and those in subsidized programs that don't fully cover our cost for seeing the patient. I mean, where else can you hire somebody and tell them, well, do a good job and I'm going to pay you 60% of your cost? I don't think you'd get many people taking that one. But that's kind of the way it is for us in healthcare. And there hasn't been any offsetting action on the state level to mitigate some of these issues. Unfortunately, many Virginians don't realize this is happening, and the hospitals are under great stress. So we're really trying to start a dialogue to alert people to the serious stakes and the potential consequences of ignoring challenges such as these. The current situation
of the campaign and where will it be seen? Obviously, we our audience that's going to be engaged with it, but where else? Tell us kind of what.
Well, it's a statewide campaign, and it's going to be visible to Virginians across the Commonwealth. First of all, I would encourage folks to visit isupportvirginiahospitals.com. Lots of information on the website, and that will point them in the right direction. It's going to be on television, radio ads, as you mentioned. They're going to begin airing in markets around the state, emphasizing our message about the serious challenge we are facing in our hospitals and the threats that these challenges pose to all Virginians. Threats that I really think need solutions, John. The message that government inaction is unacceptable is being showcased on billboards and on commuter buses and in communities across Virginia. It's also being communicated in newspapers with a lot of digital support. So we're trying to get the message out ahead of November so that as we head into the 2016 General Assembly, we have a real strong basis from which to have a dialogue with the General Assembly.
I've read and watched some of the news coverage about this campaign, and some of the pieces point out that hospitals aren't saying Medicaid expansion, which, of course, is a loaded phrase with all kinds of political baggage. You kind of know what the deal is on that. But other coverage noted that hospitals haven't endorsed a specific policy prescription yet for their financial woes, especially in some of these rural areas. Virginia hospitals previously supported Marketplace Virginia, which had some Republican backing as well, which was kind of an alternative approach to access available federal funds to support greater health care access What are hospitals in Virginia? What are they asking for now, John Fitzgerald? What is their position now?
Yeah, John. Well, what we're asking for now is to start with a dialogue, in public recognition of the very real and harmful challenges that hospitals face. The hospitals have supported Republican-backed policy solutions in these challenges. We remain ready to work with the members of both parties to find workable policy solutions, because it's going to take everybody together to work through these challenges. And the challenges are a result of current and past government statutory and regulatory actions. Remember, healthcare is a heavily regulated industry. Aside from funding cuts, the government has mandated that we provide free and discounted care. I mean, what other businesses can you think of that is told to give away services without compensation? Again,
mine.
This is part of our mission. Our mission is to provide care to the community,
right,
and we're committed to do it. But it comes at a cost. Most of the money that is raised by hospitals goes back into paid salaries for the people who are providing the care.
Right.
And we want people to see that this is a very serious imbalance in the system, which requires action, government support to remedy. Our elected leaders want the best for their constituents, and so do we. We want to, we know that having a stable healthcare system or network is great for jobs, the economy, and the public. So people recognize that too, and we're trying to make sure that this becomes center stage.
Well, look, John, at the end of the day, we're going to have to do something, right? There's no question. As I sit here, it strikes me that communicating this message to a broad audience makes sense, because it's an issue that has really far-reaching implications for so many stakeholders across the Commonwealth, not only being able to provide care and services in some of the areas that we're now providing it now, but, John, your hospital provides nearly 15,000 jobs. We're talking about lots of jobs in the healthcare community that's going to go away if we don't get to the bottom of this.
Well, you're right. This impacts, what we're talking about here impacts all Virginians, whether they live in Northern Virginia or South Side Virginia or Southwestern Virginia. This affects everyday people, businesses, local and state government. And healthcare is broad and complex. Is a broad and complex field that's connected in so many ways to society. In Virginia, the data show the challenges are real. 1/3 of the acute care hospitals in Virginia had negative operating margins in 2013. In rural communities, John, the figure was 17 of 37 acute care hospitals operating in the red. Mm-hmm. I mean, hospitals across Virginia, urban, suburban, rural, are being squeezed. I mean, one of our hospitals in our system in Northern Virginia flirts with negative operating margins almost every other year. We also had to make some very significant change to outsource services because of the effect of some of these cuts. So these painful decisions have real world impacts, both in terms of the community and I would add with emphasis the business community, because what business wants to locate it in a community that doesn't have a hospital? That's the kind of belt-tightening Virginia hospitals have already done, and many of hospitals have scaled back significantly. So this is a very serious situation, and I worry that the communities won't see it until it's gone.
John, we're going to have to figure this out, and I've been saying for months that we got to find an answer for this. Governance is about problem solving, and this is a real problem. It's, like you said, it's got far-reaching implications throughout the state, the Commonwealth. It affects jobs. It affects the economy. It's a system we're all tied into. It affects mobility. I can tell you that I like knowing that there's a hospital available to me and my family if I need one, and it's not like 2.5 or 3 hours away. Or there's a hospital that's going to provide the services I need. I don't want that to change. That's why we need to address this like the adults in the room, rather than retreating to our respective ideological corners, because this is something that it's very easy, John, to politicize. I'm no fan of Obamacare, as everybody knows. What's tougher, though, is to take a stand like a true statesman in favor of sensible solutions. That's what members of the General Assembly are elected to do. Virginia hospitals have a message that needs to be heard. Policymakers need to pay attention to this. So, John, again, remind our listeners about this campaign again.
Well, John, it's Virginia Hospitals, our Lifeline campaign, and your listeners folks around the Commonwealth can learn more about it at isupportvirginiahospitals.com.
isupportvirginiahospitals.com. Now, John, I got a couple more minutes, and we're going to be as we go into the 2016 General Assembly, regardless of who's in control of the state Senate, regardless of how the election turns out, this issue is going to be on the table. And what I really, again, want to emphasize to our listeners out there is we've got to get away from the debate about Obamacare, Medicaid expansion, Marketplace Virginia. We have to change the narrative, John, to we have hospitals in the Commonwealth of Virginia that are in trouble financially, and we've got to find a bipartisan solution to fixing the problem. Otherwise, a lot of these hospitals, John, they're going to go away, right?
You're absolutely right. And whether they go away in total or they have to cut OB services, so you might have to drive 50, 60 miles to have a baby safely, these are the kind of real issues that we're faced. And remember, not too long ago, the Ebola crisis, your hospitals were right there in the front line, standing up and ready to treat patients that came back with that horrible disease.
You're right. You hit it on the head. We're out of time. I want to thank very much John Fitzgerald, CEO of Inova, for sharing his time with us. And John, thank you so much. For more information, go to isupportvirginiahospitals.com, isupportvirginiahospitals.com. We have to solve this problem. I'm going to continue to talk about it day in and day out so that we can have the awareness of it. And John, I really appreciate you coming on today. We'd love to have you back on as this unfolds.
Okay, thank you, sir. I appreciate it.